finger down if you fell when you were 2 years old and smashed all of your adult teeth in your mouth. So when you became of age to get your adult teeth in your mouth, only some of them came in and you have a bunch of missing teeth. You go to the dentist and you're like, hey, I still have a baby tooth in my mouth and I'm in my 20s. And they're like, okay, let's try and find it. So then they try and find your tooth and then they find it right here because you still have a baby tooth right here. So then they're like, okay, we're going to take this tooth out, but I need you to see an orthodontist and the orthodontist is going to help you. And they recommend this orthodontist. So you go to the orthodontist who's like, okay, we need to take this tooth out. It's a baby tooth. It's practically just going to fall out. No big deal. And then what we're going to do is we're going to have you go under oral surgery and attach a ball and chain. And forever, how long it takes, we're going to try to pull the tooth down in your mouth to pull it into place between these two teeth here. And you go, okay. So then you go and you get the surgery with the surgeon, and the next appointment you have at the orthodontist, you think you're just going in for a follow-up, and then psych, they put braces on you that same day. And they're like, hey, you'll be out of braces probably within like the next 10 months to 12 months, maybe 18 at the latest. So then what you do is you go to the dentist like constantly, and every 2 weeks you're at the orthodontist for an adjustment, and then you have the surgery where they have the ball and chain. And so every 2 weeks, they're pulling on the ball and chain to pull your tooth down. And then they would take a x-ray every so often to check and see how the tooth is moving. So after a year goes by, there's not much change. Another year goes by, there's not much change. But she keeps thinking, the orthodontist keeps thinking that you need to see the surgeon again. So you go back to the oral surgeon who gets the order from her to laser your gums. So you go through several lasering surgeries where they have to laser your gums away to expose the tooth because your gum tissue is fibrous and it keeps growing over the ball and chain. So for years, you have perfect teeth prior to this, but then because you wanted to get the tooth down, you keep going through all of this. On the 4th year of having braces, she decides to send you back to the oral surgeon. And the oral surgeon says, hey, you know what? She's saying your tooth is moving, but if you compare your x-ray from when you first started to your x-ray now, your tooth is not moving because she wasn't judging it from your bone. She was judging the movement from your other teeth. So instead of using the nasal cavity to see if the tooth was moving or not, it wasn't. So you spent 4 years of your life pulling on a tooth that didn't move. So then he recommends that you take it out. She says, okay, fine. He's like, okay, we're going to put an implant in. She says, okay, fine. So you go in April of 2021 and you have this surgery. It is like the worst surgery to date because your entire face swells up and it looks pretty terrible and pretty pitiful. And then you have to heal to get the implant put in. So 6 months goes by and you say to the orthodontist, hey, my dentist, my oral surgeon wants to put the implant in. Is it okay at this point? And she says, yeah, you're almost out of braces. No problem. Go for it. So then you get the implant put in of September 2021 and you go into her office and you're like, okay, when am I getting my braces off? And she's like, oh, well, your teeth are pretty crooked. So we still need to fix it because they needed to shift back over. And so then she has you going in like once every month at this point, sometimes every 2 weeks, depending, to adjust your braces, only to find out that your teeth can't move because she told you to put the implant in. So then you get really frustrated because she kept telling you were almost out of braces, but then you weren't, but then you almost out, but then you weren't. And so after 5 years of having braces on, you go to a new orthodontist for a second consultation who says, oh my God, what happened to your mouth? What did they do? I never would have done this in the first place. And so then they try to help you, but they're like, hey, guess what? You can't because the implant's there and your teeth on this side can't move to go back that way. So they try and help as best as you can for about 7 or 8 months, and then they take your braces off and they say, okay, we're done. We can't help you. And then you now have crooked teeth and a crooked smile, and there's no way to fix it. And you went through 6 years of braces for no reason. Ding.